This segment of Bridge Street is sponsored by Syracuse Orthopedic Specialists.
The population is getting a little bit older, so it looks like there could be an increase in hip and knee replacement over the next couple of decades. As the need is expected to increase, Syracuse Orthopedic Specialists, they've committed to educating the community about the various options available for treatment.
Yes, Dr. David Quinzi is a member of the joint replacement team at SOS, which has 7 board-certified, fellowship-trained orthopedic surgeons specializing in joint replacement, and he joins us now. Welcome to Bridge Street.
Thanks for having me.
Yeah, so great to have you on. So what would you say are the most common causes of hip and knee arthritis?
Sure. I mean, I think the most common cause would just be the general wear and tear arthritis or osteoarthritis. Now, certainly there are folks that have inflammatory conditions like rheumatoid arthritis or psoriatic arthritis, but the lion's share is just from general wear and tear.
Are there early specific signs in a hip or a knee that people need to look out for?
Yeah, typically for a hip, growing pain, limited range of motion, knee pain, limited range of motion, that sort of thing. Pain with weight bearing, difficulty getting socks on and off, getting in and out of a car, just basic stuff.
Yeah.
So I know that, technology is helping you in your field. Talk about some of the advances in helping to treat people.
Yep. I mean, we've had a lot of, over the past 20 years, changes in the implants, but also robotic technology that assists us now with surgery, allows us to give patients a more patient-specific or patient-focused joint reconstruction.
She mentioned technology has come a long way in these types of surgeries, but it's like a last resort, right? There's going to be some recommendations probably of PT and exercise before we go down this surgical route.
Absolutely, and that's my take on things. That's my philosophy. I like to maximize non-surgical things before we jump to sort of the knife or the end of the road. Physical therapy, keeping the body moving, keeping the muscles strong, and then also treatments with non-steroidal anti-inflammatories as well as injections and other things can help prolong, the need before we need to step into a joint replacement.
I want to get to some of the goodies that you brought.
Yes.
What are we looking at here?
So this is a basic hip and knee replacement. When you do a knee replacement, everyone always asks, how much bone are you taking? It's really a resurfacing procedure. So anywhere that there was cartilage is now metal, plastic. For a hip, the components are metal, plastic, and ceramic. And it's really, we try to take the least amount of bone as possible, but also cut out all the arthritis, bone spurs, and reasons that, cause the joints to be painful.
I remember my dad got a knee replacement 25 years ago, his first one. He recently got another one.
Sure.
And it feels like the advancement has come such a long way over those almost 3 decades. And it doesn't seem as invasive as it used to be.
Yes, I mean, the old way we used to do things, patients were in the hospital, potentially non-weight bearing, there was drains, other things, restricted things that kept them in the hospital. We do a lot of same-day joint replacements now. You come in, you put full weight on your leg the day of surgery. When your pain's under control, when you clear physical therapy, which we have at our hospital and surgery centers, you go home and you do a lot of the stuff in the comfort of your home.
What inspired you to get into this field?
Sure. I mean, that's a great question. I think, in medicine, I like talking to people. I like learning about people's lives, but specifically orthopedics, we have fixes. It's a quality of life specialty. If you have a bad hip or knee, I can replace that or reconstruct that, and people generally do really well.
What is the lifespan of these replacements?
Yeah, so the older stuff, we used to tell folks, 10, 15 years. That was before my time even. But now the newer stuff, I'm telling folks for knees, 20, 30, 40 plus years. Same with hips, 30, 40 plus years.
That's incredible.
Yeah, for sure. What should someone consider when looking into a specialist?
Sure. I think, one, you have to have good rapport with your specialist. You should be able to have a conversation, find someone that listens to you. But you need to feel comfortable, Your problems are listened to, and, you can feel confident that they'll take care of you and give you a good result.
Yeah, and whether it's before surgery or after surgery, movement is key, right? You always got to keep moving.
Absolutely. I always tell folks, even with arthritic knees, get on the bike, get outside, try to enjoy nature, because all those benefits are going to help. And then after surgery, I have folks get back to biking, running, golfing, skiing, everything. That's what I want. Get back to you.
Well, thank you so much, Doctor, for filling us in on about all you offer. You have a seminar coming up. It's called The Latest Advancements in Treatment Options for Hip and Knee Arthritis. It will be held on Wednesday, March 26th from 5 to 6 p.m. The event is open to the public, and participants can register at no charge for the Zoom webinar at sosbones.com/joint seminar. Although virtual, there is limited availability, and attendees are encouraged to register early to reserve their space. This segment has been sponsored by Syracuse Orthopedic Specialists.